terminology. And at the end of these lectures, students are expected to describe the anatomical position, understand the meaning of anatomical position, apply anatomical position, and the rest. Now, first, what is anatomical position? It is the standard position in which the body assumes to describe its parts. This is to ensure that the description are unambiguous. So we are studying this anatomical position because it is applied clinically. You have to apply it. Maybe a patient is, you're advised to supervise the patient, and the doctor will ask you, place this patient in a supine position. So if you don't know the anatomical position, you won't be able to do those things. So anatomical position is to ensure that it is standardly recognized everywhere you are. So a person in anatomical position, so what are the characteristics? So if I should say stand in anatomical position, what are the characteristics of standing in anatomical position? One is standing erect or lying supine on one's back. Don't worry, I'm going to show you the pictures when we talk about anatomical position. So first is standing erect or lying supine on one's back, as if erect, with head, eyes, and toes directed anteriorly. So the eyes, the head, and the toes are directed anteriorly. Has upper limbs by the side but slightly apart from the body, with palm facing anteriorly or in the supine position. Has lower limbs together with the feet directed anteriorly. Calm down, I'm going to show you these things. The standard anatomical position of the skull is called the Frankfurt plane. In this position, the lower margin of the orbit, eye socket, and the upper margin of the ear canals lies in the same horizontal plane. Generally, this position has four features. The body is erect or supine. So this is what you have to know in anatomical position. First is the body is erect or supine. Second is the feet is parallel, palm facing forward, arms hanging by the side. So let's check the anatomical position. You said in anatomical position, the body is erect or supine. The body is erect, it's standing straight, it is supine, it is in a supine direction, as you can see in this woman standing. So whenever this woman is standing this way, we call it this the supine position, so that when you lies her back on a horizontal plane, the face will face upward. So this is what we call the supine position. Feet is parallel. Now look at the feet. The feet is parallel. They are parallel to each other. They are in the same direction to each other. The arm is facing forward. Now take a look at the arm. Now take a look at the arm. The arm is facing forward. The arm is in a supine position. The arm is in a supine position, meaning that in a supine position, we will see the palmar region, not the dorsal region of the hand. So the arm is facing forward and arms hanging by the side. So in anatomical position, body is erect or supine, feet is parallel, palm facing forward, and arms hanging by the side. Now take a look at the arm. The arm is on the side. It is hanging. It is not attached to the body. So the palm is hanging on the side. Now, this is the anatomical position. Now, in the anatomical position, the palm is hanging on the side while the face is facing forward. The body is standing erect and the feet is parallel. So that is the word anatomical position. Now, this structure here is what we call the anterior position. Why this structure is what we call the posterior position. Now, terms of position or direction. So what are the terms of position or direction? Now, we have so many lines in the body, but let's start explaining. First, we have the medial, nearer or towards the median plane. So any word or any word or anything that is medial, this means it is nearer to the medial plane. So what are the median plane? We said medial and nearer or towards the median plane. Example, the ear is medial to the median plane. The eye is medial to the median plane than the ear. Let me explain. What are these median plane? The median plane, they are imaginary lines. So have you imagined something? Just try to imagine lines that divide the body into two equal left and right parts. So the line that passes through the center and divide the body. Now look at that midline in this body. The midline divides. Now take a look at this midline. It divides the body into two equal left and right parts. That is what we call the median plane. The median plane or the mid sagittal plane or the medial or the midline. So the line that divide the body into two equal parts is called the median plane. So the word medial is any structure or anything that is closer to the median plane. So example, and any structure that is far away to the median plane, we say this is what? It is lateral. We are coming to that. But example, the ear and the eye. Take a look at the eye and take a look at the ear. The eye is more medial to the midline or the mid sagittal plane or the median plane. They are all the same thing. Why the ear is lateral? Why? The eye is more closer to the midline. Why the ear is more far away to the midline. So due to that reason, we say the ear is lateral when compared to the eye, and the eye is more medial or it is medial to the median plane. Now we have lateral, further from the median plane. So when a structure is far away from the median plane or it is more further away when compared, it is said to be what? Lateral. As I explained, the eye and the ear. The eye is more closer to the midline. Due to this reason, we say it is what? Medial. But the ear is closer to the median, but the eye is more closer. Due to this reason, we say it is what? Lateral when it is compared with the eye. Now, we have the anterior or the ventral. So the anterior is your front part. So the anterior region is your front part, your face, your chest, your belly. Your front part is the anterior median, and as you can see in this diagram, all these things are called the anterior median, while the posterior is your back. So when we talk about posterior, is the back of the body. So we're going to be using anterior mostly in gross anatomy, while ventral in mostly in embryology. So anterior is the front part of your body, while posterior is the back part of your body. Now, the posterior or dorsal, either you say it is posterior or you say it is dorsal, meaning the near is nearer to the back of the body. So when something is nearer or close to the back of the body, we said it is what? Posterior or dorsal. When something is in the front of the body, we say this is what? Anterior.